Abortion. What should I know if I choose to terminate my pregnancy? How to get rid of unwanted pregnancy without abortion? I am 2 weeks pregnant. My abortion will be safe? How many weeks into pregnancy can you have an abortion? Till how many weeks abortion can be done without any complication? How early can you get an abortion? Am I ready to parent a child? Can I afford child's expenses? Why abortion is my only solution? Can I afford it? What if my abortion comes with a complication and affect my fertility? Will having a child now have a negative effect on my future planning? What about my religious beliefs? Will they disturb me in future? Can I handle the influence and questions about my abortion from people? Am I forced to have an abortion? Or am I pressurized to keep the pregnancy? Do I need my parents' consent on having an abortion? What should I know, if I chose to go for abortion? Millions of women face surprised pregnancies every year. More than 50 pregnancies in the United States only are unplanned. In case you are one of them, you might think about pregnancy termination. Abortion is not an easy decision. Before making a decision you have to think a lot. You might need professional assistance to get all your answer. Women may need answers to different abortion-related questions. Some of them are: how to know abortion is the right option for me? What are the methods of abortion? Dealing with an unplanned pregnancy can be a tough decision to make for most women. Only in the United States, 4 out of 10 women terminate their unplanned pregnancies. On an average, 3 in 10 women in the United States will have to abort one pregnancy the time they reach 45 in age. Women can choose abortion due to several reasons, such as: women can choose abortion due to several reasons. They have a fetal health problem. They have career goals. They care about their family health and not ready to take more responsibilities. Their partner is not ready for parenting a child. They cannot take care of another toddler because their first baby is not even a year old. They are broke and have no other financial resource. They are having early pregnancy bleeding. Their pregnancy is caused by sexual abuse, rape, and traumatized. They are dealing with ectopic pregnancy, a serious pregnancy complication when the fertilized egg implants to the outer layer of uterus wall. If you think abortion is the right option for you, it is recommended to think and discuss with a professional about the advantage and disadvantage of abortion. Moreover, they will assist you the right way to terminate a surprised pregnancy. What is the most suitable abortion procedure for me? Aborting a pregnancy is not possible without the help of a professional, so always seek right assistance. Your doctor can suggest you a suitable abortion method based on your medical condition, weeks of pregnancy and your comfort. There are 2 most reliable methods that are used to terminate an unwanted pregnancy: pill method or medical abortion. Surgical method, clinical procedure. However, there are some concerns such as health issues, future complications, laws on pregnancy termination. What is a pill method? A pill method or medical abortion method involves a pill that is given to the expecting mother to terminate a pregnancy. The pill is also known as an abortion pill or mifepristone in very early weeks of pregnancy, within 9 weeks of pregnancy from the day of a missed period. How the pill works. The pill blocks progesterone, a hormone that is responsible for keeping the pregnancy. Without progesterone, your body, the lining of the uterus, cannot hold the pregnancy. When the pill is used orally, and it breaks the lining of the uterus, in result bleeding occurs. How effective is the pill method? The pill method is considered very safe. The efficiency rate is up to 97%. The first abortion pill is given at the doctor's clinic and the second one is given for home. In result, you might feel cramps and bleed. The bleeding can be heavy or lightweight, with or without clots like regular period or miscarriage. Some women also feel nauseated, dizzy, and weak and have to go to the washroom due to loose stools. It is imperative and recommended to have someone at your side. In the case of emergency, the best way is to rush to the healthcare professional. How do I know the pill method is safe? In most cases, the pill method is considered safe. However, removing the possibility of any complication can never be eliminated. However, there are fewer cases where someone gets an allergic reaction to the pill, or suffer from heavy bleeding and infection. It is also possible that some part of pregnancy is left inside the womb or left attached to the outer layer of the uterus. Moreover, in some cases, the abortion pill does not work, a medical complications, or your pregnancy is mature in week 9. In such cases, doctors recommended surgical abortion. What is a surgical abortion method? A surgical abortion is a type of clinical procedure that is used to terminate the pregnancy. A gynecologist or a trained nurse can perform the procedure in a clinic, outpatient office, or a hospital. The procedure is performed when the pregnancy is 16 weeks old after the missed period. How is the medical procedure performed? The surgical procedure is conducted in the following step. First, the expecting woman is given a painkiller to numb the cervix. Once the cervix is completely numb, a thin tube is inserted gradually inside the vagina that goes through the cervix into the uterus. The tube is linked to a vacuum which is used to suck the pregnancy. Once it is placed at the right place, uterus, it sucks the pregnancy out. Soft tissues are removed by using a medical instrument called curette. Once it is done, the doctor prescribes the woman a course of antibiotic and best rest. However, in the case of heavy bleeding, fever, pain or tenderness in the abdomen area, vaginal discharge and odor that looks like pus, you are advised to visit the doctor immediately. How is the surgical abortion method safe? When the surgical procedure is done by a professionally trained nurse or a medical doctor, then it is considered safe. However, surgical abortion may get some worst complications, such as infection of the uterus and fallopian tubes, heavy bleeding, sometimes with cramping and pain. Some women may suffer from cervix complications. Illegal abortions may have complications and are very expensive in different countries including US. When should I go for abortion? After confirming your pregnancy either through an at-home pregnancy kit or some clinical tests, start thinking about your options. And if abortion is your final decision, your next step should be to find the right clinic offering abortions. You can take suggestions from your closed family member or relatives or look online. Government has launched some helpful facilities about a reliable clinic or doctor providing this facility. Moreover, it is important to discuss the rules on abortion. Think about your insurance policy as well, as most health insurance companies do not cover abortions. In most countries including the United States, not everyone provides abortion facility. What is the total cost of abortion? Calculating total cost of abortion is difficult as it varies from clinic to clinic and on state laws. Moreover, it depends on the type of abortion procedure you are advised and the complications you may get afterward. What are the long-term risks of abortions? Many women who want to terminate their surprise pregnancy have to deal with many misconceptions such as breast cancer, complications in future pregnancies, ectopic pregnancies, miscarriages or infant issues linked to abortion. However, safe and uncomplicated, done by a trained professional, abortion does not cause any problem for future pregnancies. What kind of emotions will I have after an abortion? Terminating a pregnancy can be a very emotional event as big as ending a relationship or losing a job or even becoming a parent. There is no correct word to express how a woman can feel after aborting her pregnancy. Some women suffer from depression, guilt, regret, sad, and some even go traumatized, while some women easily go through this phase. However, severe emotional sensitivity after an abortion is as common as having postpartum depression. Women with a history of emotional problems are more likely to fall in depression after an abortion, especially if she has to terminate a wanted pregnancy. If you are one of those, then seek a post-abortion counseling service for emotional support resources and information helpful in dealing depression and negative feelings.